can watch this later. All right, so good afternoon, everyone. My name is Rachel McGill. I am the Healthcare Workforce Liaison for JMG, and I work in partnership with MaineHealth. And we put together this series of webinars called MaineHealth Monthly Mondays for us to kind of highlight different career opportunities within MaineHealth and training programs that they run. So just before we get started, I want to do a little bit of a housekeeping run through. If you have questions throughout this presentation, please feel free to put them in the Q&A section. We have allotted some time at the end of the webinar to answer these questions. And if we do run out of time, I will be sure to address them in the follow-up email that gets sent out to all of the folks who registered today. There will be a couple of poll questions that come up, and I just wanted to let folks know they are anonymous. It really is for us to just gauge what the knowledge base is of those participants who are here live. So no pressure at all. And then the last thing I'd like to say is there is a 3-question survey that's going to be prompted immediately after the webinar. And if you do have time, we'd really appreciate your participation in that. It helps us to kind of plan future events. Okay, so those housekeeping items are out of the way. Now I get to introduce the lucky guests that we have with us here today and talk about all of their knowledge in terms of the NorDx Phlebotomy School. So first we have Steve Winger, who is the manager of pre-analytic training and development for the school. And we also have Olga Pope, who is a student who actually went through the program. So she's a graduate of the phlebotomy school, and she is now a current instructor in the program. So we're so happy to have you both joining us today. And then first, I'm going to kick it off with Steve. If you could just give us a little introduction to the program before we get into the conversation, that would be fantastic.
Sure. So we work for NorDx, which is part of MaineHealth, and we have our own phlebotomy training program. And what we do is we have candidates who apply to work with us at NorDx, go through an interview process, and then we hire them to go through the training program. And we teach them everything they need to know about doing phlebotomy. And phlebotomy is really going and collecting those blood specimens from our various patients and sending those to the lab so that they can be tested. And then doctors and nurses are able to act on those results to treat and diagnose their patients. So our program is a paid program where folks can get hired by NorDx. We then put them through a 6-week training program and do some competency testing on them, and then they're part of our team.
Excellent, thank you. And I know you covered some of this stuff actually in your introduction. So first I wanted to go over what a phlebotomist actually is, but you did kind of touch on that. So maybe you could talk about what a day in the life would look like as a phlebotomist. What kinds of tasks do they perform? What settings do they work in? And who do they interact with most when it comes to day-to-day operations?
Sure. So right now we have basically 2 types of phlebotomists that are working for us. Some of those are working in an outpatient setting. And so that's where maybe a patient goes to their doctor decides they want some lab work done. They would come to one of our patient service centers. And so the patient walks in, the phlebotomist greets them. A typical day for them would be pulling that patient's orders, having them sit down in the chair, collecting the blood specimens. Sometimes we collect other specimens as well. Urine specimens, stool samples, and so on. And then that phlebotomist would also then process some of those. That might require spinning some of those specimens in a centrifuge and getting them ready to go to the testing department. Of course, there's tracking that goes in along with that in the computer system so that we are accounting for every step of the process where that specimen is in the process. And so they kind of spend their day interacting mostly with patients who are coming in to have their labs drawn. We also have inpatient phlebotomists, and those are the ones that work in the hospital settings. And they're going up onto the floors of the hospital and going from various patient room to patient room, collecting specimens on those patients and sending them down to the lab. Again, the majority of their interactions are going to be with the patients in the hospitals. And occasionally they need to interact with nurses of those patients or doctors of those patients whenever a nurse or a doctor is asking questions about whatever we might be drawing and so on. So a lot of interaction with patients. You are front facing with them, and you are right up close and personal because you have to be able to be in their personal space to collect those specimens. So, it can be very rewarding to have all those various different interactions.
Yeah, I like how you said that, because, part of JMG and helping students kind of explore different career paths is understanding how they like to work. So are you somebody who is social and likes to interact with people on a day-to-day basis? Do you like process and kind of doing routine procedures? So I think all of those things are really important when we're talking about what a phlebotomist does and if this work really aligns with the things that they like to do. So Olga, I want to kind of turn to you because you went through the program. So I'm so curious to know, what's your story? Did you always know you wanted to kind of be in healthcare and specifically in phlebotomy, or how did you get here?
I didn't know I wanted to be in healthcare. I think I kind of fell into that when I moved to Maine in 2020. From Massachusetts, and the reason why I moved is because I lost both of my jobs. I worked in retail and I worked at the airport at Boston Logan. And when I moved to Maine, I wanted to have a career change. And one day I was Googling jobs and I came across phlebotomy school. And I honestly had to Google what phlebotomy meant. Because I was never in the medical field. I was never in the hospital. And it really interested me because it was a great opportunity to have a career change. It was paid, and plus you get the job placement right away. And you get a great support throughout the whole process. So I had a great experience.
Yeah, that's super important. You hit on some of the really big highlights to this program. So it's a 6-week training program, right? So we talked about that.
6-week training program, yes. 2 weeks in the classroom setting.
Yeah, and that shocked me at first until I actually spent time in the classroom and got to see how supportive that environment is. But it's paid training, so students are actually earning an income while they're learning, and they have like that mentorship capacity. So there's instructors who are following them throughout their time in an intense way, making sure that they feel comfortable, and especially so as they go out into those clinical times. So that's really, really important, I think, to hear.
And you have the communication with the supervisors from the sites before you're actually going to get into the site. So it's also kind of comforting going into the new location and knowing the managers.
Yeah. So you kind of talked about the structure. So it's 6 weeks long, 2 weeks. Could you guys talk about that? So the first 2 weeks is at Southern Maine Community College at the South Portland campus, right?
Yeah, we have a partnership with SMCC where we are able to use one of their classroom spaces. It's dedicated to our program so that we are able to store all our supplies and so on over there, which makes it really easy for us. And we spend 2 weeks in the classroom where the students are going through various lectures and presentations. And then there's also a lot of a hands-on component to that. We do a lot of practice with the needles and so on some of our tools. We've got these arms that have all the various anatomy to them, where the veins and so on would be. And so we're able to do practice on these fake arms and so on. And then eventually we get to a point where we're practicing on each other. If you're comfortable with that, if not, you don't have to actually do that part. And so that 2 weeks really gives them the solid foundation that they need. Then the next 4 weeks, they are at the site that they were hired to work for. So it could be, for example, a hospital like Maine Medical Center, or it could be one of our small patient service centers. We also work with all the various MaineHealth facilities. So we have sites as far north as Rockland, Penn Bay area. We have sites to the west, Memorial Hospital over in New Hampshire, in North Conway, and then southern Maine, Biddeford, Portland, and all along the mid-coast. So a lot of various sites where the person could have been hired for. They'll know that going right into the program, so it's not a surprise. It's not like you live in Portland and we assign you up to Rockland. It's, we get all that worked out. The program even starts, so you know right where you're going. And they spend 4 weeks at that site with an experienced phlebotomist right beside them the entire time, continuing to draw real patients for real tests. And we call that their clinical time. And we require that they get 200 successful sticks to complete the program, which is not hard to do when you're drawing 30 or so a day. It doesn't take long to get those 200. And at the end of that program, they take a final exam. And once they pass that, their site will then do a competency check on them and determine whether they're ready to work on their own or whether they need some more time with a mentor. And it varies from person to person, and we continue to give them the support they need until they're ready to be on their own and doing the job on their own.
Excellent. Thank you for that. So you mentioned that they would know which location they were assigned to. So could we talk about what the eligibility requirements are for the program, and then what that application process does look like?
Yeah, so we only have 2 requirements. One is that they need to be 18 years old. And then the second one is that they need to have either a high school diploma or the equivalent GED, what have you. And that's the only 2 requirements of the program. So once they apply, and our talent acquisition team will do sort of like a screening with them to determine, where do you live? What site would be most convenient for you to work at? Are you thinking that you want to work in an outpatient setting or an inpatient setting? And they will then match them up with a supervisor from a couple of different sites. Those
Great.
supervisors will hold the interview and determine if they want to hire them or not. Once they hire them, that's when they come to Olga and I for their training.
Perfect. And you run your trainings, I think, roughly every 6 weeks or so, at least once a month. It seems like you start new cohorts, right?
We start a new program once a month. Yeah. So every month, 12 programs a year is what we run. So they just slightly.
Yeah.
6-week program, but we start a new one about every 4 weeks.
So for those of you who are on the call who are still high school students, you would be looking to apply to this program then sometime in June. If you wanted to start right away without any kind of break in between June or July, you could start your application once you graduate high school. And for those of you who are beyond that point already, you can start whenever in the next cohort, as long as you meet those 2 eligibility requirements. So that's great.
Yeah, they would be able to apply ahead of time in May. They wouldn't have to be fully 18 or
Okay.
to apply. They can apply before that, and that way we could get them into the pipeline. We could do all of the process. They just wouldn't actually be able to start until their 18th birthday or graduation. And those 2 requirements would be met. So it's possible they could interview in May to start in June.
Oh, great. That's good to know. So Olga, I'm curious to know how you went from, I'm going to transition to you, from a student in the program to actually being an instructor. Could you talk about that and maybe what other career advancement opportunities there are within the phlebotomy kind of world.
Sure. So after the 2 weeks training at SMCC, my clinical location was Maine Medical Center. I went there, and after 6 months of being a phlebotomist, I got trained to be working in the lab in processing. And after that, I also became a mentor because I like teaching people. I like helping people to be better and to learn things. And roughly a year after being employed at MaineMed full-time, I saw an opportunity to be a phlebotomy trainer. And I reached out to Steve and had the interview, and I got the job. I am the trainer. And it's been a great experience. And while still being a trainer, I work per diem at Southern Maine Hospital as a phlebotomist. And I help out in the Scarborough lab in the processing department. It's a lot of opportunities out there being in the medical field, and phlebotomy school gives you that window, kind of like a stepping stone in the medical field. Because I came kind of from nothing in the medical field, because I was a student, then became a trainer. And now with the help of NorDx, I came to Steve and I told him last month that I'm really interested to be working as a lab tech and to have programs, CLT and MOT paid programs through NorDx. So that's going to be my next venture. Going back to school in January to get my prereqs so I can hopefully the following year to join the CLT or MOT program to be hopefully tech in the microbiome department.
Wow, that's exciting. So yeah, so it sounds like there's a lot of different opportunities for students who may want to kind of progress on either side.
So once you in the medical field, you talk to a lot of people, you face to face with nurses, doctors, people in the lab, and then you'll know that's what I love to do. That's what happened to me. I love training, I love teaching, but I realized that being in the lab is my passion. And there's a lot of help. Once you know what you want to do, you come to your supervisor, to your manager, and they'll help you. They'll navigate you.
Yeah, that's great. That's good to hear. And I definitely felt that from being in the classroom. The level of support and the amount of kind of instructor ratio to student was so high in the classroom. So because I would personally, I was like, oh my gosh, 6 weeks to train to be a phlebotomist. But until I was actually in the space and saw the intense mentorship that was happening and the practicing that the students had, it's pretty incredible what you can do in that amount of time.
Yeah, and I can also add that we've had a number of people that have gone through our program that have progressed into becoming techs. So they're working with the analyzers now, doing the testing, resulting those tests, looking at things under microscopes and so on. They've taken that next step. We also have a number of folks who went through that did phlebotomy for a couple of years while they were going to nursing school, and now they're full-time nurses. We have one person that's a full-time doctor now. He was a phlebotomist with us for a little while, and while he was in med school. We've got a number of folks who went through that are PAs, physician assistants, so that next step down from being a doctor, but still working with patients and diagnosing and so on. So there's a lot of opportunities on that side of things. And then on the other side, we have some folks that went through and they were phlebotomists for a while, and then they became like a group lead for their site, and now they're into the management side of things. So they are supervisors. In one case, we have one that became a manager at one of the sites. So there's that, there's the leadership side that you can progress through, and then there's the scientific side and the actual patient care side that you can also, so there's a career ladder on both sides. for people who go through our program.
That's really great to hear. And I love what you both said about kind of getting in the door and networking, like just being within the healthcare industry. There's a lot of opportunities to kind of talk to people. So while this may not be like your end all be all, this could be a really good entry point for folks to kind of really narrow down what it is they might want to kind of focus on next.
Yes, and our company, MaineHealth in general, is very supportive of that. We want to see people grow, and we want to see them meet some of their goals and maybe meet their ultimate dream job. So we never hold anybody back from that. We always support them in trying to progress to that next level, whatever it might be, even if it's not within the laboratory and it is, you know, nursing or whatever it might be. We want to support them and help them grow. And one of the things that we can always say is that nurses who have gone through as phlebotomists really understand laboratory side of it. So when they're doing things within their department that relate to lab results and so on, they have a good, clear understanding of what they're working with.
Oh, so a little insider tip. That's kind of cool to hear. So I do want to transition slightly, but we're hearing a lot about kind of workforce shortages across the board in healthcare, and students are definitely hearing that message. So I'm curious to know, what are you guys experiencing both on the phlebotomy side and potentially the lab side? Are the needs as dire for your neck of the woods here?
Most definitely. We do have a number of openings right now. I think we have about 30 openings for phlebotomists currently, and there is a nationwide shortage on the tech side. So that is definitely a career path that, you know, pretty much guaranteed immediate employment if you were to go to college and become an MLT or, you know, a medical technologist. There's definitely a need for that. A good place to start is in the phlebotomy side of things, like Olga was saying earlier. MaineHealth is going to be helping her to get that. We have paid training programs, and we have scholarships that we offer for people to go back to college and get the degrees that they need in order to be a tech. So that kind of summarizes how severe the shortage is when we're willing to pay tuition for folks to go and get those degrees.
Yeah, absolutely. And you know, even just the phlebotomy program, so it's paid training while you learn, and then a pretty high likelihood of job placement at the end of this once folks successfully complete the program. So
right.
Yeah,
And
okay.
the paid training is for that 6 weeks, and immediately after you finish that 6 weeks, you get a raise and a bump in title. So you go from student to MLA1, which includes a significant raise. And then within a year, you would progress to an MLA2, which again is another pay increase. So opportunity for overtime as well. So, you know, plenty of opportunities there.
Yeah, that's awesome. Thank you. I have one or two questions to wrap up, but it does look like we got a question in the Q&A section, and this is a really good one. So I'd like to ask you guys, if you don't mind, what kinds of interests or skills might make someone a good fit for the phlebotomy school? What are you looking for in candidates, essentially?
So what we're looking for is that they be somebody that can meet the MaineHealth, our core, values. So our core values, and our core values are patient-centered. So somebody who really has empathy for patients and that ability to really interact well with them. Somebody who shows a lot of respect for both patients and their colleagues. Somebody who has integrity. These are some of our core values. if they have those, we can teach everything else.
If you're willing to learn, we'll
yes.
teach you.
Yeah, so somebody who loves to learn, we can teach you all of that. Having a interest in the sciences is important. And then that I guess that ability to be able to see some things that some people might say are a little bit gross, you know, like you're holding somebody's blood in your hand and things like that. But if you have like a strong interest in that type of thing and you don't get squeamish around blood and needles, that's a big plus.
Yeah, that's probably a good plus. I was a little nervous coming into the classroom, but I was okay when I was in there. So Olga, I thought maybe this, and maybe Steve too, just to share maybe a meaningful kind of interaction that you had, or maybe sharing like what you like best about the work that you do currently.
What I like the best about being a trainer is you see people coming in on day one, they're very nervous, they're not sure it's the job is for them, and they're able to do it. And at the end of the 2 weeks, they're very confident, like they blossom. They're very confident in their skill, and they are good phlebotomists that already can draw blood because they're gonna go draw blood on actual patients. And I love seeing that transition, how people they learn the skill and and you see them progress at their sites to become techs, or they go to be enrolled in school to be a nurse or PA. It's very, very rewarding. I love that.
Great, thank you.
And for me, I love the interaction with the patients. That's my favorite part of it, especially when you are able to help somebody who is very nervous about having their labs drawn. There's somebody who maybe has had a difficult time in the past because they have some veins that are difficult to find. And when you're able to go in, and especially if you can go in, get it on that first try after they're telling you that they're really difficult, and then to see them smile and be excited about the fact that you got it. And it was sort of a simple process that one time, and it kind of really makes their day. That's what I like the most.
I agree.
That's great, because that kind of hits on both sides of it, the training and, you know, kind of the front, the patient facing role. So that's great. So we talked, the program is 6 weeks. You guys are rotating on a cohort starting basically every 6 weeks or once a month, and what the application process looks like. Maybe we'll wrap up because we have about 2 more minutes to talk about what advice would you give to someone who's interested in pursuing this as a career?
So my advice would be to go ahead and apply and, you know, come in and do the interview and find out more. If in the end you decide, nope, this isn't for me, you can always say no if we make you an offer. But you'll never really know unless you put your foot out there and give it a try. And I know, Rachel, you and I have talked about the possibility of some folks doing a job shadow or coming into the classroom, that you may be able to bring a few folks in to see what it's like in the classroom. I would say jump on that opportunity and come in and check it out and see if it is for you.
You should apply. It's a great opportunity.
Yeah,
Definitely.
Yeah, I would definitely say you won't know unless you give it a try. And if it doesn't work, no harm.
Excellent. Well, I want to take just a second to thank you both for your time today and for sharing your kind of knowledge and experience with us. And for folks who are listening right now, I will be sending out an email with the recording of this webinar. So if you need to share that out with anyone who was unable to attend, and If there's any follow-up questions that folks had that we didn't get to, please feel free to send me an email back and I'm happy to kind of meet with you. But at this point, we hit our time right on time. So I want to say thank you again and let everybody get back to what they were doing for the day.
Thank you, Rachel.
Thank you, guys. Have a good day, everybody.
All right. Bye-bye.
Bye.